This medication helps to treat muscle spasms and pain. It is typically used with rest, physical therapy, and other treatments. It may work by causing drowsiness and helping to relax the muscles. This medication is administered through injection, either into a vein or a muscle, as instructed by your doctor. The injection will be given by a healthcare professional. If it's administered into a vein, your doctor may ask you to lie down during and for 10 to 15 minutes after the injection to reduce the chance of side effects. Some common side effects of this medication may include drowsiness, dizziness, lightheadedness, nausea/vomiting, blurred vision, or pain/redness/irritation at the injection site. If any of these effects persist or worsen, contact your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's important to inform your doctor immediately if you experience any serious side effects such as fainting, slow heartbeat, signs of liver problems, mental/mood changes, or seizures. Although rare, a serious allergic reaction to this medication can occur, so seek medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, make sure to tell your doctor or pharmacist if you have any allergies or any medical history, especially kidney disease, liver problems, or seizure disorder. This drug may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can make these effects worse. Avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. Also, avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of this drug, especially confusion, dizziness, or drowsiness, which can increase the risk of falling. If you are pregnant, only use this medication when clearly needed, and discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Be aware that other medications or herbal products may interact with Robaxin 100 mg per milliliter injection solution, which could affect how well your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Let them know if you are taking any other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, other muscle relaxants, or antihistamines. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness. This medication may also interfere with certain lab tests, so make sure to inform lab personnel and your doctors that you are taking Robaxin 100 mg per milliliter injection solution. If someone has taken too much Robaxin injection solution and is showing serious symptoms like fainting or difficulty breathing, call 911 or a poison control center immediately. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, contact a provincial poison control center. Overdose symptoms may include extreme drowsiness, dizziness, seizures, or loss of consciousness. This medication should not be shared with anyone else. The injection solution of Robaxin, also known as methocarbamol, is a type of medication that belongs to the class of central muscle relaxants. This medication is used to treat muscle spasms and pain. It works by helping to relax the muscles. Robaxin is typically administered by a healthcare professional in a medical setting. It is important to follow the dosage instructions provided by your healthcare provider. Common side effects may include drowsiness, dizziness, and lightheadedness. If you experience any severe side effects or have any concerns, be sure to contact your healthcare provider. This medication is not available for home use. It is administered in a hospital, clinic, or doctor's office and should not be kept at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.